We ask so much from people who are living with CF. They have so much more to do in their just daily life.
And this is Emmeline, and she's 6 months old. We wake up about 7:30 in the morning. She has an 8-ounce bottle 4 times a day. Enzymes, Zantac, her vitamins, and that's usually our daily routine with feedings.
When I wake up, I do my albuterol first, and then my Pulmozyme. And while I'm doing that, I do my vest, so I do both at the same exact time.
I do an hour and a half of treatments every morning, consisting of 4 different nebulizers and the therapy vest.
Do my nebulizer treatments, do my pills, do my airway clearance.
Albuterol and then nebulizer cup, and then using my vest to shake up my chest, and then go eat breakfast, go to school.
I get up, I take my pills, disconnect my bag, I do nebulizers in the car on the way to school.
Having CF definitely is a roller coaster ride. And sometimes you can't always predict and you don't have control, which is very hard.
He basically takes this as a game, but I always tell him, it's a game, yeah, but you gotta take it seriously too. You can't really skip a day without treatment or anything like that, because then you're gonna get sick and eventually go back to the hospital, which is not our goal.
Keeps us busy, our schedule's always full, but we get it done.
Yeah, I've heard from many patients over the years how anxiety-provoking clinic visits can be and how worried they are about their pulmonary function numbers.
And it really can derail the whole visit because they're so anxious and upset about it. We also have patients that avoid coming to clinic as often as we'd like because they're so nervous about those numbers.
Definitely getting your PFTs and thinking about your FEV1 is something I always worry about.
I didn't want to come in and do PFTs. I just wanted to go see the doctor. I knew I was going to get bad news. And I just was like, give me the bad news, give me the medicine, and let's see what we can do to make it better from here.
Coming into clinic, the first visit was very nerve-wracking. She was losing a lot of weight. We didn't know what was going on.
Like on days like today, I'm not feeling that great, so I was worried I was going to get sent into the hospital.
On the scale of numbers versus quality of life, I think we tend to focus more on the quality of life to make sure he's got a great experience of actually living.
We just make it work, in life, because quality of life is very important. And he has to be a 9-year-old boy.
The numbers, as we know, aren't everything. So usually when I'm coming into the room, I want to gain an understanding, first of all, hey, how are you? This is not just a patient, this is a person, and make the visit personal.
When I go in to see the patient, I start with discussing what's been going on with them, how they're feeling, what they're doing, before I talk about the numbers and the pulmonary function testing or the weight.
We have many folks who come together to help take care of our patients with CF from many different angles. And so in that same vein, we try to support them from many different angles.
What I love the best is they make sure that he's okay, not just physically, but mentally too.
So what I really try and do is meet the patient where they're at that day that I see them in clinic and talk about what their current barriers are, what's getting in the way of you doing your treatments or what's getting in the way of you being more active.
Quality of life is very important too. We still have to try to maintain home as normal as we can. He's a kid, he wants to play.
So we definitely try and work with them to kind of address that issue and reassure them that no matter what the numbers are, we're there with them to try and figure things out and make a plan to address it.
Partnering with patients and families in cystic fibrosis care is extremely important because the successes and measures that they take at home are really, it's all on the families and the patients.
It's always a discussion. It's never, you're going to do this, you have to do that.
I always feel like they're flexible and willing to work with what's important to me.
I don't think we can do a good treatment plan if we're not incorporating the family and the child's wishes and what they feel like they can do and can't do.
It's not just the physicians that make the decision. They involve James, they involve us, the parents, the family, and they really take into consideration, how everyday life is, and we make the decision together.
So there's definitely a lot of conversation, negotiation to see what works for us as a patient and what they want to see to improve.
So it's not me prescribing, this is what you need to do. It's a mutual decision to try to understand what the best approach is at that time.
It is so important for me to be able to partner with my care team in really every decision that I make.
Even when I leave the clinic, I feel like the team is still with me.
This is a hard job. This isn't a job that's every 3 months. This is every single day, and we have to work together.
You think you can't do it. As a family, you're like, we cannot handle one more, treatment modality. But you find if you do it slowly and have support and encouragement, know that you have someone there, you can ask questions if you're doing it right.
When his weight was getting so low, Dr. Landon pulled us into another, office and said, there is this option, maybe it is time for a G-tube. And his dad was there with us, and we all talked about it. And then Cindy was there, and we all decided together that it is time. It is the best for him. And they gave me the pros and cons, and we decided as a group.
So over the past couple of years, my numbers had been continually dropping, and my team and I decided that it was time to start the talk about transplant. And we had decided that, my health's decreasing, my lung function's decreasing, and my quality of life was decreasing. So it was time, and we all got together. We had a meeting with my family, my fiance, and my doctors.
I really think the key is getting to know them and making sure they are aware that they have a voice in this, that we're not going to dictate what they have to do.
When we were going to tell him about the G-tube, Cindy and one of the GI doctors actually met us at a park and told him there, and made it a really pleasant experience instead of telling him at the doctor's office and really overwhelming him.
We sat down and we talked about, there's a possibility you can make it out of it, there's a possibility you can't. You need that positive family reinforcement and that family love all around. And not only did I feel it from my family and my fiance, but I felt it from my doctors.
Our goal is to be there to support our patients, and every step along the way that they may encounter that may be a little bit tougher than they expected, and to celebrate those steps that go well and be able to pick them up if the step doesn't go well.
I think that if people are actually keeping track of what they're doing in terms of exercise, in terms of lung function, in terms of oxygen levels, they're going to be more apt to stick with their treatments.
A few years back, we did a study using fitness trackers and getting patients on the pediatric side involved. And Tyler was one person that really took it and ran with it.
Yeah, I think technology is important to consider. One technique that we use are encouraging patients to find a med adherence app.
From an adherence standpoint, there are a lot of apps through the phones that a lot of our patients do utilize. There's also something called My Med Action Plan, which a lot of pharmacists use to print out each patient's medication regimen, and it has the picture of the medication, what time they should take it.
I use two different systems. I use the Fitbit, and I use that to measure steps and all the different elements they have on there.
There's lots of different ways that I've seen patients have fun with it and be successful, have, video game style ones where they're getting, coins or rewards through the system that they really like. So it helps kind of bring a different fun element to the monotony that can come with doing all their treatments.
I had an app called Mango Health, which was on my phone, and it gives you points for every pill you take, and you sign up and list all your pills on there, and it will give you points for them, and those points can add up for gift cards.
So I've used a couple apps to help me with my steps, tracking my steps, increased physical activity. I've had apps give me reminders to keep moving.
You can track all your nutrition, all what you're eating, all your calories, your carbs, everything else helps you lose weight, helps you gain weight depending on what your goal is.
I also use the health app on my Samsung because it measures some of the similar things, but also does oxygenation. And so I can check my oxygen levels on a regular basis.
Having a Fitbit helps me kind of stay on track and gives me those daily reminders to stay active, and even if I'm not feeling great, even just go for a walk, because that's something. So I love having my Fitbit.
When I did the study with Karen and the team, we actually got on a goal that was, we're gonna start you with 5,000 steps a day. Let's stick to that. And then we would come back for a visit and we'd say, okay, well, you're doing well. Let's bump it up to 8,000. And it was that thing that every time, I wanted to see, hey, I got that goal. I can reach that goal. I can do better than that goal.
I think it's great because, most people are more connected to the online world, the phone. So if we can find those types of programs that are going to be motivating.
So Tanner does not use any technology. He just has Mom constantly reminding him.
With CF, there are lots of challenges and bumps along the way and depressing periods. So I think it is really important to encourage patients when they're doing well and point out the positives.
Victories are a huge part of my life, before and after transplant. Before, to me, it was just every year that you had a birthday. I mean, some people take it as, oh, it's just another birthday, I'm another year older. To me, that was, I'm another year I'm alive. I'm still here, I still have family, I'm still breathing.
I'm not a gigantic celebrator of events, but I got married. I told my wife I had 5 years to live, something like that. And she's like, well, let's give it a shot anyhow. So we just had our 30th anniversary, and we did celebrate by going overseas for a month.
It's very important to kind of celebrate the victories, but what a victory would be can be defined differently by different people.
I absolutely celebrate victories every chance I get, even the little ones. I think it's important with a disease like CF to acknowledge any victory, no matter how big or small.
And that everyday thing may be an objective measure in clinic, but it could also be something as simple as getting an A on a math test or joining Boy Scouts.
One way that I help celebrate victories when a patient's PFTs are up or a new baseline, we always recommend, now that's a PFT you go home and put on the fridge.
Part of my job too is just to make sure that the people know that we're working with and caring for, that they know how much we care about them, because we do. We worry about the same things they worry about, so we're legitimately happy when they have victories, when you've gained weight and we know you've been struggling with that.
I'll try to do something fun, spend a day at the park with my daughter doing something that she would like to do, because she gets super excited when we do things like that.
Our victory is basically having the few months or those 3 months and not having any other issues. Actually just being a normal family, not having any health issues.
Might go shopping for a new little dress or some shoes. It's so hard having this journey, it's a lot. So it's a small victory and it's something that I need sometimes for a little bit of motivation.
I sometimes consider every time I'm able to hang out with my friends kind of like a mini celebration, because it means I'm able and well enough to actually hang out and run around with them.
Just relaxing at home, being with family, being with friends, being with people that care about you and love you. You just realize that you're still here, you're here for a reason, and every day is a victory to me.
I think the most important thing for doctors and nurses and all those other professions to help their patients is to just be there for them. The most important thing about it is the support that you get. The general feeling that there is someone you can trust, someone you can laugh with, someone you can cry with, all these different sort of things. And just really having that connection with your patient, I think, is definitely the most important.
Thank you for all that you do. Thank you for your dedication. Thank you for your time and your effort that you put into patients. I know it goes beyond, just what you do every day at work.
My CF Care team is like my family. I've known them for forever, it seems.